The minute you hit the button to treat the patient, essentially our eyes close. And this technology allows those eyes to stay open. You can visualize what you're treating.
Radiation is not like surgery. You don't necessarily see the knife going somewhere. You don't see the tumor coming out like in surgery. So for the physicians, it's important that you see what you're doing. And for the patients, it's good to know that you actually hit the area that was intended with the right amount of radiation.
Once you see what's going on inside the body that we're treating, once you have that vision, you're not going to close your eyes again.
Finally, we have the tools, the device, everything put in place in a way that we're going to be able to change the treatment on the fly.
ViewRay is an idea that when we treat cancer patients with radiation and attempt to cure them of their disease or mitigate their pain and suffering, that we need to see what we're doing.
It is incredible what this instrument can do in terms of delivering precise radiation therapy to the tumor.
This is a high-tech physics machine, and it's extremely well designed, and it's able to do what it's supposed to do very nicely. So I'm impressed by the excellent engineering that's gone into developing the product. This machine gives you the capability of not only recognizing that problem, but doing something about it day by day, and not having to replan, rescan, wait a week for the QA, and then finally get your new plan maybe 2 weeks later, where you've treated another 2 weeks with the wrong plan.
Adaptive radiotherapy has been talked about for a long time. No one has really done it. This is the first machine that I believe has the real potential to do that.
We can see certain anatomy better, we can see things that we just haven't seen before. And even just a small preliminary study that we did with patients at Washington University, it was an imaging study. We've seen things that we couldn't see before that have actually potentially changed treatments of some of the patients that participated in that study. And this is just a glimpse of what will be done.
What excites me most about the ViewRay system is the MRI. Clearly the game changer is real-time imaging and MRI soft tissue contrast. In fact, I just saw yesterday a cine movie of a pelvis that was acquired in 90 seconds that would rival any diagnostic MR scanner image I've seen. I'm not an MR physicist, so maybe I can't tell the subtle variations, but I can tell you I was absolutely shocked at the quality of that image, and it took 90 seconds to acquire on the ViewRay system.
With MRI-guided radiotherapy, you're imaging and you never stop. You continually image throughout the therapy delivery to make sure everything's on target. And if we see something out of place, we stop the beam.
I think the thing that's most exciting is the ability to really expand the high-dose, small number of fraction treatment techniques. That's going to make it possible to achieve the high local control rates that we've seen with small tumors in the lung with SBRT. I think we can extend that to many other parts of the body because we'll see what we're doing every day. We do 5 fractions that are extremely accurate. I think we're going to see miraculous improvements in local control.
I think ViewRay's job is to be the company that sheds light inside the patient. We basically remove a fog or a cloud. ViewRay is all about therapy and vision, helping execute the medicine that the physicians are bringing to their patients to help effect a cure, save precious human lives.